Imagine this: in the United States alone, an estimated 130 people die every day from an opioid overdose. That's a shocking statistic, isn't it? But the truth is, it's not just a statistic. It's a grim reality that many of us may have to face, and it's centered around something seemingly innocent: prescription painkillers. Painkillers, particularly opioids, are often seen as a safe haven. After all, they're prescribed by healthcare professionals, and they provide relief from some of the most intense pain. But that's where the common misconception lies: the idea that because they're prescribed by doctors, they must be safe. But in reality, these medications carry a high risk of abuse and addiction, even when used as directed. The numbers paint a chilling picture. Each day, more than 1,000 people are treated in emergency departments for misusing prescription opioids. In a single year, over 11 million people misused prescription opioids. These figures are not just numbers. They represent real people grappling with addiction, struggling with the side effects, and in the worst cases, losing their lives. But why is this happening? One of the main reasons is the lack of understanding about the potential dangers of these drugs. Many people believe that prescription painkillers are less addictive or less harmful than street drugs. This is a dangerous assumption. Prescription painkillers can be just as addictive and harmful. Additionally, painkillers are often overprescribed, leading to a surplus of medications in households. This excess availability can lead to misuse and abuse. It's a vicious cycle that's causing a significant public health crisis. So, we're left grappling with a paradox. On one hand, painkillers provide much-needed relief for those suffering from chronic pain. On the other hand, they pose a significant risk of abuse and addiction, leading to devastating consequences. With this grim reality, it's time to delve deeper into the world of painkillers, their use, their potential for abuse, and their safety. Before we delve deeper into the world of painkillers, we'd like to note that the information provided in this video is intended for educational purposes only. It's crucial to remember that while we aim to provide accurate and up-to-date information, this content should never replace professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider for any questions you may have regarding a medical condition or treatment options. Misuse of prescription medication can lead to serious health issues, including addiction and overdose. If you or someone you know is struggling with addiction, seek immediate help. Remember, knowledge is power. By understanding more about painkillers, their uses, and potential risks, we can make more informed decisions and promote healthier, safer communities. Now let's move on to understanding what painkillers are. What are painkillers exactly? They are drugs that interact with your nervous system to decrease or eliminate pain. Now let's delve a bit deeper into what these drugs are all about. There are several types of painkillers, each with a unique function and purpose. Over-the-counter painkillers like aspirin and ibuprofen are non-steroidal anti-inflammatory drugs, or NSAIDs, that work by reducing inflammation and fever. Then we have acetaminophen, found in Tylenol, which is not an NSAID, but also helps to reduce fever and relieve pain. Prescription painkillers, on the other hand, are a different story. Opioids, such as oxycodone and hydrocodone, are often prescribed for more severe pain. They work by binding to opioid receptors in your brain, blocking the perception of pain. While they can be effective in managing pain, they come with a significant risk. You see, the potency of opioids is a double-edged sword. On one hand, they can provide relief from severe pain. On the other, they have a high potential for addiction. This is because opioids not only block pain but can also trigger a release of dopamine, a neurotransmitter associated with pleasure. Over time, the brain may start to crave this pleasurable sensation, leading to dependence and addiction. But let's not forget about another type of prescription painkiller: corticosteroids. These are meant to reduce inflammation, and they do so by suppressing the immune system. While they can be effective for conditions like arthritis, long-term use can lead to side effects like weight gain and weakened immune response. So painkillers, in essence, are complex substances. They interact with our bodies in ways that can both alleviate pain and potentially cause harm. Knowing the basics of painkillers and how they affect our bodies can help us understand why they may not always be the safest or most effective option. Before we move on to the dark side of painkillers, it's crucial to understand the importance of informed usage. Painkillers, when used correctly, can be a godsend, helping to manage pain and improve quality of life. But remember, every painkiller, be it over-the-counter or prescription, has potential side effects and risks. The key to safer use lies in being informed, knowing what you're taking, why you're taking it, and how it can affect your body. Always follow the dosage instructions and never hesitate to ask your healthcare provider if you have any questions or concerns. It's your body. You have the right to know and understand what goes into it. On that note, let's take a quick pause. If you find this content helpful and want to stay informed, make sure to hit that subscribe button. Sharing is caring, so don't forget to share this video with your friends and family. They might find it helpful too. Now let's dive deeper into the potential risks and dangers of painkiller misuse in our next section. Painkiller abuse is a growing concern worldwide, but what does abuse really mean? Well, let's dive in. Painkiller abuse refers to the misuse of these medications either by taking them in a way not prescribed, using someone else's prescription, or consuming them to experience a high or other pleasurable effects. This is a risky behavior that can lead to severe health consequences and even fatal overdoses. Now let's talk about overuse. Overuse occurs when a person takes more of the medication than recommended, often in an attempt to manage persistent or worsening pain. This can unintentionally lead to a physical dependence on the drug, setting the stage for potential addiction. Misuse, on the other hand, is when the painkillers are used for purposes other than relieving pain, such as to induce feelings of euphoria. This is particularly dangerous as it often involves taking high doses, which increases the risk of overdose. So how does one identify the signs of painkiller addiction? Well, addiction is a chronic disease characterized by compulsive drug seeking and use, despite harmful consequences. Signs can include a growing tolerance to the drug, withdrawal symptoms when not taking it, unsuccessful attempts to cut down or control use, and continued use despite knowing the harm it's causing. Let's not forget about the long-term effects it can have on one's health. Prolonged abuse of painkillers can lead to a myriad of health issues, from liver and kidney damage to mental health disorders and even brain damage. It can also lead to social and financial problems and negatively impact relationships and work. This is not just about the individual. The ripple effect of painkiller abuse and addiction extends to families, friends, and communities, causing emotional turmoil and societal burden. It's a public health issue that calls for awareness, understanding, and proactive measures. Abuse and addiction are serious consequences of painkiller misuse, causing harm not only to the user, but also to those around them. Remember, prescription painkillers are powerful drugs. They need to be respected and used responsibly. Many believe that the stronger the painkiller, the more effective it is. But is that really the case? This is a prevalent notion that many of us hold. It's easy to think that a more potent drug will do a better job of relieving pain. But the truth is far from this assumption. The effectiveness of a painkiller is not solely determined by its strength. It's a complex interplay of several factors. Let's delve into this a bit. For starters, individual tolerance plays a massive role in how well a painkiller works. Over time, our bodies can develop a tolerance to certain medications. This means that you might need higher doses to achieve the same pain relief. And that doesn't necessarily mean it's more effective, it's just that your body has adapted to the drug. Next, the type of pain you're experiencing significantly influences a painkiller's effectiveness. Not all pain is created equal. For instance, opioids might be highly effective for acute pain such as post-surgery pain, but they may not work as well for chronic pain like arthritis. Additionally, other factors like your overall health, age, and even genetics can impact how well a painkiller works for you. For example, certain genetic factors can make individuals more responsive to some types of painkillers, while others might not respond at all. So it's not a one-size-fits-all situation. Scientific research supports these points. A study published in the Journal of Pain and Symptom Management found that stronger opioids did not necessarily provide better pain relief. Instead, it emphasized the importance of individualized treatment plans. So it's time we debunk this myth and understand that stronger doesn't always equate to more effective. It's crucial to consult with a healthcare professional who can assess your unique situation and prescribe the most suitable pain management strategy for you. Remember, stronger doesn't always mean more effective when it comes to painkillers. Be informed, be mindful, and always prioritize your health. Safety is another misunderstood aspect of painkillers. How safe are they really? Let's delve into the side effects of painkillers, both short-term and long-term. It's important to understand that while painkillers can provide temporary relief, they also come with a set of potential risks and side effects. Short-term side effects can range from mild to severe, including nausea, constipation, dizziness, and even respiratory depression. These side effects can be disruptive to your daily routine, making simple tasks feel like monumental challenges. Long-term use of painkillers can lead to even more serious issues. Dependence is a real concern. Your body can become used to the drug, needing more of it to achieve the same level of pain relief. This is a slippery slope that can lead to addiction. Overdose is another risk associated with long-term use of painkillers. As the body develops a tolerance to the drug, there's a tendency to consume more than the prescribed dosage. This can result in an overdose, which can lead to severe health complications, and in worst-case scenarios, death. It's also worth noting that long-term use of certain painkillers can lead to liver damage, kidney problems, and even heart issues. The body wasn't designed to handle these substances in large doses or for extended periods of time. Now, this isn't to instill fear or to discourage the use of painkillers entirely. They are, after all, a useful tool in managing pain, but it's crucial to understand the potential risks and to use them responsibly. We've covered a lot of ground today, from understanding painkillers to debunking myths and exploring the reality of their safety. It's clear that when it comes to painkillers, knowledge is power. The more you know, the better choices you can make for your health. But our journey doesn't stop here. There's always more to learn, more myths to debunk, and more truths to uncover. We're committed to providing you with the information you need to make informed decisions about your health. So please, if you found value in this video, consider subscribing to our channel and sharing this video. Your support allows us to continue creating content like this. And don't forget to turn on notifications so you don't miss out on our future videos. We have a lot more content planned, from exploring other types of medications to delving into different health topics. So stay tuned, stay informed, and stay safe. Remember, your health is in your hands and we're here to help you navigate it. Thank you for watching, and we'll see you in the next video.